The Kidney Safe Walking Guide 20-minute low-impact routine for better blood pressure. Good morning and welcome back to the channel. How often do you wake up feeling utterly drained? Notice that slight puffiness under your eyes, or see a persistent foamy layer when you flush the toilet. Maybe your blood pressure reading seems to creep up every morning, or you're making too many trips to the bathroom overnight. For years, we've been told these are just normal signs of aging. We shrug them off, grab another coffee, and get on with our day. But what if I told you that these common annoyances aren't normal at all? What if they were quiet whispers from your body urgently signaling that your kidneys are under severe stress, struggling to filter the toxins that accumulated overnight? I'm Dr. Mattheus from Kidney Health 365. My patients often come to me frustrated because their general practitioner simply says drink more water or eat less salt. While that advice is correct, it misses the critical factor: your morning routine. Many of you are starting your day with seemingly harmless habits that actually put enormous strain on your already vulnerable kidneys, potentially leading to increased creatinine, a dropping GFR, and dangerous toxin buildup. You're missing the simple daily actions that can actively protect your renal health. Consider this: a recent large-scale study following over 20 adults over the age of 50 found that those who incorporated just 150 minutes of light to moderate physical activity per week saw an average 12% reduction in their systolic blood pressure readings within 6 months. That's a significant difference, often enough to keep your kidneys out of the danger zone. Ignoring these subtle signs and failing to adopt a kidney-friendly morning habit can push your organs toward damage, requiring more serious interventions. But please don't panic. The fear is real, but the fix is simple. You have the power right now to reverse this trend. The solution isn't another restrictive diet, it's a simple low-impact routine. Our first step is a habit that takes less than 2 minutes to start, but can completely change how your kidneys manage blood pressure and flush out waste every single morning. Let's start walking. So now you understand why those morning signs might be a big deal. But let's get down to the essential question. Why walking? It seems too simple, doesn't it, when you're dealing with complex conditions like high blood pressure or chronic kidney concerns? You might think you need high-tech equipment or intense cardio. But the truth is, walking is perhaps the single most effective low-impact medicine available, especially for those of us managing kidney health after 55. Here's the direct connection. The biggest threat to your kidney function is consistently high blood pressure. Think of your kidneys as having millions of tiny, delicate filters called nephrons. When your blood pressure is high, it's like a fire hose constantly blasting these filters. Over time, that force permanently damages them, leading to decreased GFR and toxin buildup. Walking, even at a moderate pace, addresses this root cause directly. By engaging the large muscles in your legs, you strengthen your heart. A stronger heart pumps blood more efficiently using less effort, which naturally lowers the overall pressure in your blood vessels. Fewer blasts, healthier filters. Furthermore, walking helps stabilize your blood sugar levels. Given that diabetes is the leading cause of kidney failure in the U.S., controlling that sugar is paramount. A study published in the Clinical Journal of the American Society of Nephrology emphasized that exercise is a crucial non-pharmacological strategy for improving BP control in individuals with CKD. This is not about pushing yourself to exhaustion. It's about consistency and finding the sweet spot for intensity. To make sure you're in the safe and effective zone, we use 2 simple methods. First, the talk test during your walk. You should be able to hold a conversation, maybe pause every few sentences, but you certainly shouldn't be gasping for air. Second, the rate of perceived exertion RPE scale. On a scale of 1 sitting on the couch to 10 all-out sprint, we want you right around a 3 or 4. That's enough effort to feel slightly warm and know you're working, but gentle enough not to cause unnecessary stress on your body. Now that we know why we're walking, let's make sure we do it right. Because even a simple activity like walking can lead to injury if your form is off. Let's talk about the non-negotiables: proper form and safety gear. Before we take that first step, setting yourself up for success is just as important as the walk itself. For anyone managing a health condition, especially kidney issues, safety isn't optional, it's mandatory. This segment is dedicated to the non-negotiables: the right gear and the right form. First, let's cover gear and hydration. If you take one piece of advice from this video, let it be about your shoes. You need supportive athletic shoes that fit well. Walking in flimsy sandals or worn-out sneakers increases your risk of joint pain and falls. Given that maintaining balance can be a concern for many people over 55, especially those with certain health complexities, good footing is crucial. Next, water. Hydration is essential for every metabolic process, including filtration. Keep a bottle nearby. However, I must give a strong reminder here: if your physician or kidney care team has prescribed specific fluid restrictions due to your kidney stage, you absolutely must adhere to their guidelines. Listen to your medical professionals on this point. Now let's focus on proper form. A safe walk starts from the top down. Keep your head up looking forward, not down at your feet, to maintain alignment in your neck and spine. Your shoulders should be relaxed and slightly back, preventing that forward slouch that restricts breathing. When you swing your arms, keep them relaxed and close to your body, swinging forward and backward, not across your chest. This gentle swing naturally helps propel you forward. Finally, your foot strike should be a smooth heel-to-toe roll. Avoid slapping your feet or taking overly long strides. Keep your steps controlled and manageable to minimize impact on your joints. Remember, every cue here is designed to reduce strain, manage your energy safely, and maximize the blood pressure benefits we just discussed. All right, your shoes are tied, your posture is aligned, and you know your safe intensity level. It is time to put this knowledge into practice. Let's start the clock on our guided 20-minute kidney-safe routine. All right, the clock is starting right now. We are entering our warm-up phase, which will last for exactly 3 minutes. This is arguably the most important part of our routine, especially when managing blood pressure and kidney health. We're not pushing anything yet. Our goal here is simple: to gradually tell your heart, lungs, and muscles that it is time to work. This gentle transition helps prevent sudden spikes in heart rate or blood pressure, making this routine completely kidney safe. Your rate of perceived exertion, or RPE, should be about a 1 or 2. You should feel very light effort, almost like you're just strolling around the house. Let's start with a very slow, comfortable walk. Feel that heel-to-toe roll we talked about, keeping your steps light and easy. For the first minute, we're focusing purely on movement and breathing. Take a deep breath in through your nose, hold for a moment, and exhale slowly through your mouth. Remember, the smooth, controlled nature of this warm-up is key to safely increasing circulation. Now let's incorporate some gentle shoulder movement. As you continue walking slowly, roll your shoulders up toward your ears, pull them back, and then drop them down. Do this 3 times forward. Feel the tension melt away from your neck and upper back. Good. Now reverse the direction, 3 gentle rolls backward. Keeping your upper body relaxed helps promote better posture for the rest of the walk. Next, we're going to focus on our ankles, which play a huge role in walking mechanics and balance. While still moving slowly, lift your right foot slightly and gently rotate your ankle clockwise 5 times. Keep a hand on a wall or a stable chair if you need extra support. Then switch, rotating counterclockwise 5 times. Now, switch feet and repeat the rotation clockwise and then counterclockwise. Great! Ankle mobility is vital for fall prevention, which is a significant concern for seniors. For the final minute of our warm-up, we are going to do a very slight knee raise. As you walk, gently bring your knee up just a few inches higher than your usual stride. You are not marching high, you are simply encouraging a larger range of motion in your hips. Do this alternating legs for about 30 seconds. This is gently firing up those large leg muscles, the quadriceps and hamstrings, which will be doing the heavy lifting during our brisk pace. Keep that slow, steady walking pace going. Notice how your body feels. You should be starting to feel just a little warmer, maybe noticing you're breathing more easily. That means your muscles are ready and your cardiovascular system is gently primed. We are coming up on the end of our 3-minute warm-up. In just a moment, we will be transitioning into the main event, our blood pressure lowering brisk pace. This is where we safely increase our effort to achieve that kidney protective cardiovascular benefit. Keep your form tight, your posture tall, and let's move seamlessly now into our brisk pace. Welcome to the heart of our workout, the brisk pace. This phase will last for 6 minutes, and it is the single most effective portion for achieving that critical goal, safely lowering your blood pressure and actively protecting your kidney filters. This is where we safely elevate our effort to a moderate intensity. You should now increase your speed just a notch. Don't rush, but move with intention. We are aiming for an RPE of about 3 to 4 out of 10. Remember the talk test? You should be able to speak in short sentences, but perhaps not comfortably carry a long, detailed conversation. If you can still sing, you need to pick up the pace a little bit. If you are struggling to speak at all, you need to slow down immediately. Listen to your body. It is giving you the best feedback. As you maintain this brisk, steady rhythm, let's revisit your posture. Keep your core gently engaged. Think about pulling your belly button slightly towards your spine. This supports your lower back and enhances stability. Maintain that smooth, rhythmic arm swing. The gentle forward and backward motion is actually a major component of walking efficiency, helping you maintain pace without unnecessary strain on your knees or hips. Focus on your breathing now. Try to establish a 3-to-3 pattern. Inhale for 3 steps, exhale for 3 steps. This controlled deep breathing maximizes oxygen delivery to your muscles and helps keep your heart rate steady, which prevents dramatic stressful spikes in blood pressure. We are already 2 minutes into the brisk pace. Keep that energy steady. Think about the incredible work your body is doing right now. Every single controlled step is an investment in your long-term renal health. You are teaching your heart to be a better, more efficient pump. This simple, consistent movement reduces vascular stiffness, which directly eases the pressure on those delicate nephrons we discussed earlier. We are halfway through this segment. Now is the moment where consistency matters most. If you feel like slowing down, just hold your pace for 30 more seconds and then assess. If you're feeling great, maintain this effort. If you feel any dizziness, chest discomfort, or unusual shortness of breath, please immediately stop the brisk pace and transition to the slow, cool-down walk. Your safety comes first. For those of you continuing, let's use the remaining time to truly embody that proper form. Focus on the ground, land lightly on your heel, roll smoothly through the arch, and push off with your toes. This gentle roll cushions your joints and prevents unnecessary impact. Keep your steps measured and deliberate. We have about 1 minute left in our brisk pace. Push through these final 60 seconds. You're doing fantastic work protecting your health. Maintain that RPE of 3 to 4. Feel the gentle warmth in your body and the steady rhythm of your breathing. Excellent effort. We are about to transition out of our peak exertion phase. We don't want to stop suddenly, as that can stress the heart and blood vessels. Instead, we are moving smoothly into a brief period of active recovery. We are now entering a critical 1.5 minute phase active recovery. The natural inclination after a brisk effort is to stop completely, but for kidney health and cardiovascular safety, we want to bring your heart rate down gradually and smoothly. This slow transition is essential to prevent blood pooling in the legs and to avoid sudden drops in blood pressure, which can be dangerous, especially for older adults. You should immediately decrease your pace to a very slow, almost leisurely stroll, the same pace you used at the beginning of the warm-up. Your RPE should drop back down to a 2 or 3. This means your breathing should become instantly easier, allowing you to return to full, comfortable sentences. Now is the time to really focus on deep, deliberate breathing. Inhale deeply, filling your lungs, feeling your diaphragm expand. Exhale, slowly releasing any remaining tension. Controlled breathing during this recovery period sends a signal to your nervous system that you are safe, helping to naturally lower your stress hormones and consequently aiding in blood pressure regulation. This isn't just a physical recovery, it's a mental one too. A study in the Journal of Gerontology highlighted the importance of active recovery in cardiovascular rehabilitation, emphasizing that the gentle continuation of movement helps clear metabolic byproducts more efficiently than abrupt rest. As you slow your pace, consciously relax your shoulders and unclench your hands. Notice the difference in the rhythm of your feet. They should be barely making a sound as they meet the ground. If you're walking outside, take a moment to appreciate your surroundings. If you are walking in place, focus on maintaining a sense of centered balance. Check in with your body. Are you feeling any sharp pain, any unusual shortness of breath? If so, please stop and sit down or hold on to a stable support and continue your deep breathing until you feel better. Remember, we are here for sustained health, not momentary exhaustion. We have about 30 seconds left in this recovery period. Use this time to prepare mentally for our brief final brisk push. Think of it as a final effective boost to circulation before we cool everything down. This short burst is designed to maintain the cardiovascular benefit we established without pushing you past a safe fatigue limit. It's a smart way to end the exertion phase of the workout. Keep that gentle walk going. You are doing wonderfully. This active recovery demonstrates respect for your body and your kidneys. It shows a mindful commitment to safe, low-impact exercise. The slow pace is about to end. Get ready to transition smoothly. We're going to pick up the speed one last time, reminding your heart how strong it is. Time for our last minute of elevated effort, the final brisk push. This is a very short, targeted segment designed to cap off the cardiovascular benefits of our walk. For just 60 seconds, I want you to return to that solid RPE 3 or 4 pace, the same pace you held during the main Brisk Pace segment. Remember, this is the power zone for blood pressure management. Lift your knees slightly higher, swing your arms purposefully, and drive forward with that steady heel-to-toe roll. For this minute, be intentional about every single step. This final burst helps improve vascular function by maximizing blood flow, briefly an essential component for kidney health. This minute is about reminding your body, particularly your heart, of the endurance and strength you've just built over the last several minutes. Do not push yourself past the point of being able to speak comfortably. This is a push, not a sprint. We are focused on safety and efficacy, not breaking any speed records. Keep your breathing controlled. Inhale deeply, exhale fully. If you feel any strain, drop the pace immediately. There is zero shame in modifying or slowing down. Listening to your body is the smartest thing you can do for your health, especially when managing complex conditions. We're halfway there, 30 seconds remaining. You are so close to completing the movement portion of this powerful routine. Every single one of these 30 seconds is a bonus for your health. Focus, form, and breath. This is the moment to reinforce those good habits. 10 seconds left, drive through it. You've successfully completed the most challenging part of the kidney-safe walking routine. Excellent job. Time is up for the brisk push. Now we are entering the final stage of our overall workout, the cool down. You must resist the urge to stop abruptly. We're going to slow our pace right down to the slowest walk you can manage, almost a march in place. We need to gradually bring your heart rate all the way back down to its resting state, which minimizes stress on your heart and circulation. Keep that gentle march going as we transition. We have to properly cool down and stretch before we finish. Let's move smoothly into post-walk stretches. Fantastic work on completing the movement portion of our kidney-safe walk. Now we enter the cool down and stretching phase, which is non-negotiable for safety and recovery. We are aiming to hold each stretch gently for about 15 to 20 seconds. This helps signal the nervous system to relax, improves flexibility, and reduces muscle soreness tomorrow. Importantly, it helps your heart rate and circulation normalize, slowly minimizing any stress on your blood vessels. Let's start with the calf stretch. Please find a stable wall or a sturdy chair. Place your hands on the wall for balance. Step your right foot back, keeping that heel planted firmly on the ground. Bend your left knee slightly until you feel a gentle pull in the back of your right lower leg. Remember, we are aiming for a gentle stretch, not pain. Hold this for a slow count of 15. This is essential as tight calves can affect your walking gait and increase fall risk. Release slowly and let's switch legs. Step the left foot back, heel down, bending the right knee. Hold for 15 seconds. Next, we move to the back of the thigh for a gentle hamstring stretch. Stand tall still, using the wall for support if needed. Extend your right leg slightly forward and rest your heel on the ground. Gently hinge forward at the hips, keeping your back straight. Do not round your back. You should feel a slight pull along the back of your thigh. Hold. Release slowly. Switch legs. This gentle movement improves overall circulation and flexibility in the posterior chain. Finally, let's quickly stretch the front of the thigh with the quad stretch. Use your chair or wall for balance. Gently lift your right foot behind you and grasp your ankle or pant leg. Pull your foot gently towards your glute, keeping your knees close together. If you cannot reach your foot, simply lift the foot and hold the knee slightly back. You will still feel a stretch. Hold for 15 seconds, then switch sides. Perfect. You have safely transitioned your body from activity to rest. Now that our muscles are warm and relaxed, there's one final crucial step to complete this kidney-safe routine, and that involves putting back what we've used. We have completed the full 20-minute kidney-safe walking routine. Before we wrap up, let's address that final vital step: hydration. Now that your body is warm and your blood flow is optimized, it's the perfect time to replenish. Please grab your water bottle and take a few slow, deliberate sips. This is crucial for aiding your kidneys in flushing out the toxins we've helped mobilize. I must reiterate this seriously. If your physician or kidney care team has given you specific fluid intake restrictions, you must strictly follow those guidelines. Prioritize your doctor's advice above all else. So what have we accomplished today? We learned that those subtle morning signs, fatigue, puffiness, or high blood pressure spikes, are often calls for help from your stressed kidneys. And we've armed ourselves with the simplest, most effective prescription: a consistent, low-impact walk. Remember, this 20-minute routine is your daily defense against rising blood pressure and dropping GFR. I need to emphasize the urgency here. Kidney problems often progress silently. By the time symptoms become severe enough to warrant concern, significant damage may have already occurred. That is why starting today matters more than waiting until tomorrow. Don't let fear paralyze you. Let it motivate you. You absolutely have the power to influence your health trajectory. You don't need intense, grueling workouts. You just need consistency and intention. You are stronger and more resilient than you know. Start small, just 3 to 5 times a week, and build from there. Your next steps are simple. First, immediately set a time for your next kidney-safe walk. Maybe it's tomorrow morning.
Second, check your shoe condition to ensure you're walking safely.
Finally, and this is deeply important, the information shared here is for educational purposes only and should never replace the advice of a qualified medical professional. Before making any significant changes to your exercise or hydration routine, always consult your kidney doctor or healthcare provider. If you found value in this guide and are ready to take control of your kidney health, please hit that subscribe button right now and turn on the notification bell so you don't miss our next video on the 5 common foods that spike creatinine levels. I also recommend checking out this video right here on the screen about incorporating gentle stretching into your dialysis days. Thank you for walking with us, and we'll see you next time.